imagine, you can treat breast cancer without surgery. So that is incredibly exciting for our women.
I don't want to sit around and think about whether or not there's another cancer growing in my breast.
I can't say it enough times. Go for your mammo.
Be comfortable with your care, ask questions. Don't drive yourself crazy over statistics.
I listen to music prior to, during, and after surgery.
I never put that disease in the front seat with me. It always took a back seat.
What patients like Joanne are doing is they're pushing the needle forward to develop the better treatments for tomorrow.
These days, lasers are used for everything from cataracts to commonplace cosmetic procedures. A new study at New York Presbyterian examines whether laser ablation is a viable way for women with small breast cancers to avoid surgery completely.
My cancer was found with a mammogram. The diagnosis was precancerous.
Virginia did some research and heard about a clinical trial that she might qualify for.
This is Virginia's mammogram. She presented to us with a small mass that was detected on a screening mammogram. For this particular study, we are selecting women with very small, early-stage breast cancer. So cancers that are up to 2 centimeters in size in the breast, and it has to be in an ideal position in the breast, not too close to the skin, not too close to the chest wall, so that we can treat this safely and effectively.
They made me aware that I would have to have a lumpectomy after the laser treatment. So I agreed to do that.
We would then treat them using laser under ultrasound guidance. They are followed with additional imaging, such as MRI, to see how effective the treatment has been. We've enrolled 61 patients. Patients were very excited about this.
I hope that the laser treatment gets approved, because that would be terrific for women. It was like going into a dentist office, no problems whatsoever.
Being part of research to make things better was a great motivator.
Approximately 50% of women with breast cancer will qualify for this procedure. I think that really the main appeal is that now it's not only desirable, but possible to treat cancer without surgery. Surgery may be associated with pain, with scarring, with much anxiety. This new treatment, so far what we've seen is that there is less bleeding. It's much more convenient for the patient.
I'm 70 years old. I hadn't been for a mammogram in 2 years. The one important thing that I would say would for women to have regular scheduled mammograms, because if they had not caught my breast cancer in the beginning when it was very small, they might not have been able to perform the laser surgery.
Downtown at NYU, we caught up with another 70-year-old who had a whole lot to say on the subject of mammograms.
My cancer was found due to a routine mammo. You're not your mother, you're not your aunt, you're not your grandmother, you're you. So if there's no family history, that doesn't mean that you're not going to get breast cancer. And I'm living proof of that.
Ann Dalzell has just benefited from a new procedure that will help avoid repeat lumpectomies. It's called a MarginProbe.
NYU was the first institution in New York City to obtain the MarginProbe for clinical use. The MarginProbe device is a device that uses radiofrequency spectroscopy to examine the edges of lumpectomy tissue after it's removed from the breast. In order to be confident that we have completely removed the disease, we always look very particularly at the edge of the tissue. We call that the margin. That can be a big challenge in the operating room. Frequently, breast cancer is microscopic, and it can be very difficult for a surgeon, even using all the cues that we're accustomed to. If there is even one positive reading on any surface or margin, then the surgeon re-excises that area, takes additional tissue from that area at that time in the operating room, and this has been shown to lower the incidence of patients needing additional surgery.
It's estimated that at least 20% of the patients in this country need repeat surgeries to achieve that clean margin.
Re-excisions are difficult for the patient. They're difficult for the healthcare system. Sometimes re-excisions also can delay other therapies as they become necessary. Since we've begun using this device here, one of our surgeons has essentially halved her rate of re-excisions.
It was done at 10 o'clock in the morning. I was home at 4, and I was out to dinner the next night.
Meanwhile, Dr. Schnabel is testing the use of another new device. It's called Scout. It will make life easier for patients whose cancers are just too small to be felt.
If those abnormalities are not palpable, they have had to undergo a localization procedure before surgery that traditionally involves putting a wire into the breast on the day of the surgery to help the surgeon know which piece of tissue to focus on. The Scout device is a novel device that can be placed into the breast prior to surgery within a week. It's a device that is almost like it uses GPS or a wave technology. It's a little reflector that's placed into the breast, which gives an infrared signal that bounces off the reflector and bounces back without having to put those localization wires in. Frankly, this area of surgery has been without technology developments for a very long time, and it's about time that we get to take advantage of some of these tremendous advances.
Progress. We need it. Coming up, a researcher with the American Cancer Society driven to create a solution for the problem of hormone-driven cancers that eventually develop a resistance to drugs. She was on a mission, and you're going to meet her next.